Hi everyone, my name is Camille Savoie.
And my name is Sylvie Rey.
We are both nurses and doctoral candidates in nursing at Laval University in Quebec City. We are also the International Learning Collaborative members. In this video, we are pleased to present to you the results of our scoping review. The International Learning Collaborative was founded in 2008 at the Green Templeton College, Oxford University, UK. The ILC is an international network bringing people together to transform and improve how fundamental care is delivered, taught, and researched. The figure you can see here illustrates the fundamentals of care framework. This framework is built around three dimensions that are the relationship, the integration of care, and the context of care. A practice process also exists that helps everyone concerned to use the framework in real situations of care. You can find a lot of information on the ILC website. The scoping review was carried out by a joint Quebec and Japanese team shown in this slide. We really want to thank our co-researchers a lot for their engagement in the project. Fundamental care, or FC, is a broad and heterogeneous concept in nursing and health sciences. The dedication of a field of research related to FC is recent. A significant number of concepts, studies, and publications already exist on the subject, and more has been done since the creation of the ILC. Adjustments have been made over the years. Moreover, some studies, special issues, and reviews on FC have been published. There is a lot of material on FC, which makes it difficult to do a thorough review of the scientific data. The aim of this scoping review was to investigate and describe the current state of knowledge about fundamental care in terms of populations, context, concepts, and gaps. This process allowed us to systematically identify the research done in this field, as well as to consolidate what is known and find any potential existing gaps in knowledge. The scoping review was built around the recommendations of the 9 steps proposed by Peters and others in the GBI Manual for Evidence Synthesis book. 4 databases were selected for their relevance to nursing, healthcare, and social care. Moreover, the list of references of the retained articles was scrutinized. A comprehensive search strategy was undertaken in the databases using search terms based on 5 concepts such as fundamentals of care, fundamental care, or fundamental nursing care. Literature in English and French was considered for the database search to cover the 2 languages of the first 2 authors. Articles published between 2010 and 2021 were included. 2010 was chosen because it represents the year when the work on fundamentals of care started. All types of literature was considered, for example, studies, reviews, discursive paper, and theoretical articles. Theses, social media, and personal blogs were excluded. Relevant articles had to be published or accepted. We started our selection process with 741 articles. After the screening process, we finished with 107 articles. The selection process is presented with a Prisma flow diagram that you can see here.
Here, you can see the world map that will help us to present the authors from their countries. As you just heard, 107 articles were returned for the review. As far as the first authors, we can see that the first position is held by Australia and New Zealand with 47 articles. that represents 43% of the returned articles for the review. The second position is held by the north of Europe, that represents 40%. Then there is North America. After that, we find the south of Europe and Asia. It's interesting to see that no first author comes from Africa nor South America. As far as the second authors, the first position is held by the north of Europe, the second by Oceania, and the third by North America. Asia has 3 contributions, while the south of Europe and Africa have 1 contribution each. Once again, South America has no second authors. In summary, we can see that if we add south of Europe with north of Europe, they are in the first position with 45% of all the 107 returned publications. Oceania has 44%. That means Europe and Oceania have almost 90% of the publications. We can also present what the target contexts of the articles are. We can see the majority of the articles are related to clinical contexts. We can also see that the hospital context is the most frequent one. The general context is represented by any other clinical setting or multiple clinical healthcare settings. We can also see that 69 articles are about nursing. That can mean fundamentals of care is mainly related to nursing rather than another professional context. Finally, only 7 articles have no particular context because they are articles on methodology, commentaries, editorials, or critical articles. We can now discuss the designs of the studies presented by the articles. In fact, 37 articles didn't present a study or study results, which represents 1/3 of the articles. It is very interesting to see that the other articles present plenty of research study designs. For example, qualitative designs are ethnography, phenomenology, case study, descriptive or qualitative explorative designs. 2 articles present randomized controlled studies. Other quantitative studies were done with observational, cross-sectional, and cohort designs. Here, we discover the participants described in the returned articles. Firstly, adults are the most represented compared to children and other older adults. We can also see nurses are more represented than other healthcare professionals. As you can see, 52 articles have no participants because they are not research articles. Now, let's discover together in which journals the articles were published. Half of the articles were published in the Journal of Clinical Nursing. We can observe that 2 special issues on fundamental care were published in this journal, which explains this result. The Canadian Journal of Nursing Leadership also presented a special issue on fundamental care with 8 articles. The remaining 45 articles were published in other different journals. Among these journals, 39 have nursing or nurse in their titles. 6 journals without relation to nursing in their titles mention research about involvement and engagement, caring sciences, critical care, emergency care, health organization and management, and wound practice and research. Only one journal is a French language one.
A summative content analysis was done on the 292 keywords presented in the 107 retained articles. The keyword fundamental appears in 60% of the retained articles. That means that some articles relating to fundamental care would not have been identified using only terms related to fundamental. The word basic is integrated in 3 keywords that are basic functions, basic nursing care activities, and basic nursing care. These 3 concepts using the word basic, when all put together, represent a total frequency sum of 74. The concept of nursing dimension also appears frequently in 58% of retained articles. Other professions are hardly mentioned at all, with nursing mentioned in 64% of articles. The same situation is observed with regard to the participants in FC studies, nurses being by far the most represented. In FC literature, one can find many references to the person-centered model of care, which explain why 20% of the retained articles present a keyword related to the person or patient. The keyword relation was chosen for 19% of the retained articles. Finally, other keywords appear, such as quality, science, experience, theory, and model. Most of the literature addressed the fundamentals of care framework in general. More specifically, some articles focused on one or several of the 3 dimensions of the fundamentals of care framework. 11 articles dealt with integration, 1 with context, and 5 with relation. 19 articles didn't include the fundamentals of care framework, even if they related to fundamental care. The fundamentals of care practice process was rarely a topic of an article. Indeed, 86 of the articles included did not use the fundamentals of care practice process. Only 15 articles mentioned it. The fundamentals of care practice process represent a clinical reasoning process that includes the framework. It would thus have been interesting to use the fundamentals of care practice process more to promote fundamental care in care and educational setting. The scoping review has some limitations. For example, we excluded papers in other languages than French and English, which may have limited access to certain crucial insights. Also, another limitation is that we did not carry out an in-depth content analysis of the articles included. We categorized and quantified data of the articles relating to the fundamentals of care. Nevertheless, it would be interesting to do a more thorough analysis to better situate the extent of the currently existing knowledge regarding the fundamentals of care. The scoping review highlights the high number of articles that were published in a relatively short period of time, considering that work on fundamental care began only 10 years ago. The articles included in the scoping review are related to dimensions other than research, such as practice and teaching. These articles are related to the fundamentals of nursing care, but also to nursing theory. Finally, most of the articles focus on nursing, but other healthcare professionals took part in the research and writing, showing that fundamental care must be managed in an interdisciplinary manner. These results will help guide further work on the fundamentals of care in relation to the 5 ILC actions, which are value, talk, do, own, and research. This presentation was possible with the help of several people. We want to acknowledge Dr. Susan Pierce, ILC Steering Committee Content and Operations Manager, and Ms. Helen Walker, ELC Support. We also want to acknowledge Ms. Marie-Claude Laferrière, librarian at Laval University, for her valuable support and help in designing the search strategy. Finally, we want to thank Ms. Suza Bernard, English teacher, and Ms. Micheline Harvey, translator, for the English language review.